everyone. A very warm welcome to all. I am Dr. Dhanasri.
And I am Sanika, Master of Hospital Administration students from Aster Academy. Together, we extend our heartfelt greetings to our distinguished guests, faculty members, students, healthcare professionals, and participants joining us from different parts of the country.
It gives us immense pleasure to welcome you to the first webinar of Astricus 27 pre-conference webinar series organized by the Department of Hospital Administration, Aster Academy. This webinar series has been thoughtfully designed as the curtain raiser to Astricus 27 International Conference and Workshop on Advancing Healthcare Management. Through this series, we aim to create a platform for knowledge sharing, meaningful discussions, and professional networking that will inspire innovation and excellence in healthcare management.
We are delighted to welcome our esteemed speaker, Dr.Nalanda Jayadev, Regional CEO, Central Kerala and Aster Medicity, Aster DM Quality Care Limited. We also extend our heartfelt welcome to our Dean, Dr. Asama BV TM, our respected HOD, Professor Ranjit Kumar K, our Principal, HODs, esteemed faculty members, delegates, healthcare professionals, and dear students. Your presence truly enriches today's session.
With great respect, I invite our esteemed Dean, Dr. Asuma BV TM, to formally inaugurate today's webinar. Ma'am, over to you.
Respected resource person, distinguished faculty members, dear MHA students and participants. A very warm welcome to all of you to the webinar series of Astricus 2027, the International Conference on Advancing Healthcare Management, organized by the MHA students of Aster Academy with the support of faculty. We have consistently witnessed enthusiastic participation in previous years with these type of webinars with at least more than 450 participants per session. It is indeed a privilege to have you all join us for this important academic session. The healthcare sector today is undergoing rapid transformation driven by advances in medical technology, digital health, artificial intelligence, and evolving patient expectations. Alongside these developments, healthcare administrators are increasingly required to navigate a complex landscape of legal regulations, professional accountability, patient rights, organizational governance, and ethical decision making. Hospital administrators play a pivotal role in ensuring that healthcare institutions function effectively while maintaining the highest standards of legal compliance and ethical integrity. Every administrative decision, from patient confidentiality and informed consent into quality assurance, risk management, employment practices, resource allocation, and data protection. This has significant legal and ethical implications. Understanding these dimensions is therefore not merely an academic requirement but a professional necessity. As future healthcare leaders, you will be expected to balance the organizational objectives with compassion, justice, transparency, and respect for human dignity. Sound knowledge of healthcare laws and ethical principles empowers administrators to make informed decisions, minimize institutional risk, strengthen public trust, and foster a culture of patient-centered care. These webinar series will provide an excellent opportunity to gain insights from very experienced experts who will help you people understand the practical challenges and emerging issues in healthcare administration. I encourage participants to actively engage in the session, reflect critically on the discussions, and make the most of these valuable learning experiences. I extend my sincere gratitude to our esteemed resource person, for sparing valuable time to share expertise and practical experiences with us. I also thank the organizing team and faculty members for arranging this enriching academic program. With these words, I warmly welcome each one of you once again and wish you an enlightening and thought provoking webinar. Thank you so much. Thank you all once again.
HOD to set the context for the webinar through the theme presentation.
Good evening all. Respected Dr. ʀᴇ괱ᴜᴜᴜ, Dean, Astricus Academy, our speaker, Nalanda Jayadev, principals, HODs, faculty and staff of the Department of Hospital Administration and other departments of Astricus Academy, colleagues from Astricus Hospital, and delegates from various institutions. Greeting to everyone. On behalf of the Department of Hospital Administration of Astricus Academy, that we are organizing the conference Astricus 27 in the month of January 2027. As a prelude to this event, students are expecting a series of monthly pre-conference webinars on diverse and contemporary in health led by eminent speakers. Over the past 3 years, our department has successfully organized both national and international conferences on advanced management and wide appreciation from the participants. We remain committed to continuing such initiatives which provide valuable platforms for professional development, academic exchange, and teaching. For our MHS students, these events offer meaningful opportunities to transfer theoretical knowledge into practical managerial competencies. Marks the first webinar of the series on the ethics versus compliance. We are pleased to note that the session attracted under registration from participants across India and abroad. A sound understanding of both medical ethics and legal compliance is essential to navigate ethical dilemmas, minimize legal risks, and uphold integrity in the healthcare practice. We are honored to have an expert, Dr. Regional CEO, Central Kerala and Aster Medicity, Aster DM Care Limited. With extensive experience in medicine, law, and healthcare leadership and administration, he brings valuable insights into today's discussion. I congratulate our students for the dedicated efforts in organizing this webinar and extend my best wishes for its success. Once again, I warmly welcome you all and wish you an engaging and insightful session. Thank you all.
Thank you, sir, for your valuable insights. Before we begin today's academy session, let's take a brief moment to reflect on the vision behind Aster MIMS Academy and the journey of Astricus 27. Aster MIMS Academy, the academic wing of Aster DM Healthcare, is committed to nurturing competent healthcare leaders through quality education, academic excellence, research, and practical exposure. The Master of Hospital Administration program, affiliated with Kerala University of Health Sciences, combines classroom learning with hands-on training, hospital exposure, industrial visits, research, and placement opportunities in reputed healthcare institutions.
Following the remarkable success of Astricus 23, our national conference and workshop Astricus 25, and Astricus 26, our international conference Astricus 27 continues the proud tradition of bringing together renowned experts, researchers, administrators, and students to exchange ideas that shape the future of healthcare management.
This year's conference promises inspiring keynote sessions, expert panel discussions, scientific presentations, and engaging workshops that address emerging trends and innovative practices in healthcare administration. We are confident that this webinar series will serve as an excellent foundation for the exciting events ahead.
Today's webinar, titled Medical Ethics versus Legal Compliance, emphasizes how ethical principles and legal obligations work together to shape safe, responsible, and patient-centered healthcare system. This topic underscores the need to align ethical decision-making with legal responsibilities in today's healthcare environment.
We are delighted to have participants joining us from various institutions and organizations. Your enthusiasm to learn and engage reflects our shared commitment to advancing healthcare management through continuous education and collaboration. We encourage everyone to actively participate and make the most of this learning opportunity.
I request all participants to keep your cameras on, remain actively engaged throughout the session, participate in the interactive Q&A, and make the best use of this learning opportunity. Just a quick note, to ensure a smooth presentation, your microphone will remain muted. If you have any questions, please type them in the chat box, including your name and institution. We'll address selected questions after the presentation.
Now, it's my pleasure to introduce our esteemed speaker, Dr. Nalanda Jayadev, Regional CEO, Central Kerala and Aster Medicity, Aster ʀᴇ괱ᴜᴜᴜᴜ Limited, a medico-legal consultant and healthcare administrator. With expertise in medicine, law, and healthcare administration, he has spent over 2 decades leading digital transformation, quality improvement, and patient-centered care while advancing clinical excellence and sustainable growth. At Rajgiri Hospital, he established the Clinical Forensic Medicine Unit and the Institutional Ethical Committee with extensive experience in healthcare ethics and medico-legal issues. He has also served as guest faculty in medical jurisprudence at NOELS, Kochi, contributing to the fields of medicine, law, ethics, and healthcare policy. We are privileged to learn from your experience and perspective. Sir, with great respect, the session is now over to you.
Thank you, Professor Ranjit and the organizing team, and a very good evening to all of you. I'll be sharing my screen. Is this visible?
No, sir.
How about now?
Yeah, now it's.
Yes, sir.
Yeah. So thank you all, and I'm really happy to be in the middle of young healthcare administrators. My venture into this field of medical law and ethics started as a junior doctor, where I happened to encounter a lot of dilemmas. I had the opportunity to work in various departments, including the emergency medicine department and the ICUs. So these are some of the commonest questions that I used to face. And I'm sure as administrators at some point, or probably on a daily basis, if you're in a busy hospital, you will face such questions. I'm talking slow so that my voice will not break, and I hope the voice is clear.
Yes,
Yes,
sir.
sir, it's clear.
Sir, your screen is visible. Your Meet Google Meet screen is visible on the slide. It's above the slide.
Okay. Is it okay now?
Yes, sir. Yes, sir.
Yeah,
Yes, okay.
thank you. Okay, so these are some of the questions that will, at some stage you will encounter such questions. You may be a clinician, you may be an administrator, but these are the questions which will, commonly you'll encounter during your healthcare practice. It's not just the responsibility of the doctor anymore. The administration also has to chip in and address these issues. So on a regular basis, I still get such questions from doctors, from administrators, sometimes from lawyers, and sometimes from police. So I have selected 5 top questions and I'll try to, throw light on how best one can address this. Before that, I'll just, what is an MLC and when can I intimate the police? These are the two questions which will occur repeatedly. Is my screen changing?
No, sir, it's not changing.
How about now?
Yeah, it's okay.
Yeah.
Thank you.
So regarding one of the common question in the emergency is whether you need to intimate cases of broad death. Okay, if you're an administrator, it will come to you. So what do we do? The doctor is examined the person and declared as broad dead. Now, whether we intimate the police, these are some of the basic questions that you will encounter. Many times, by default, to be on the safer side, it's a practice to intimate the police, which is a good practice. I don't say no. But what happens after that is a challenge for the family members. The near and dear ones find it very difficult to, accept the fact that the body of the dear ones has to be autopsied. So there's a government order which clearly states that if the doctor is able to figure out the cause of death, then there is no need to intimate the police. This material will be circulated to you subsequently, though there is a government order, very clear. Also, it outlines the conditions or situations where one has to intimate the police. So this itself will give you a lot of answers and solutions. Keep these two documents with you, and many times you will avoid confusion, both for your doctors as well as for your patients. Few of the conditions where you need to involve the police are cases of suspected homicide, suicidal deaths, unknown unconscious patients who die within 24 hours of hospitalization, death on operation table, suspected unnatural death like road traffic accidents, hanging, drowning, then unexplained deaths. So these are the things. The order is very clear, and many of you may not be aware of such an order. That's the purpose of displaying it here. Okay, this is for the state of Kerala. I'm sure there are similar orders for other states. Okay, so that will address some of the common questions. There are larger questions which have to be addressed, which are related to the consent. Who can consent? Now, in my early days, I had a patient who came with severe abdominal pain. Female patient, young female, came with severe lower abdominal pain. Now, ultrasound is suggestive of ectopic pregnancy, right? Now, we should do further tests, including a UPT. So, who will consent? I assume that the patient will consent, but the patient happened to be a minor, and the parents denied consent, and they took away the patient. Now, what happened to the patient subsequently is not known, but I felt that there is something gray. There is something that even my seniors could not advise me about. So such instances kept on happening before I decided that it's time to pursue some law. Okay. Ignorance of law is not an excuse. As an administrator especially, you cannot say, I didn't know the law, so I did not take the consent, or I did not intimate the police. No. Ignorance of law is no excuse. I know it sounds strange, but that is how it is. Okay. You have to be aware of what the law is. Not because you will implement it, but the more dangerous part is you should not break it. You should not break the law. So in case there are situations where if you fail to inform the police or you release a dead body, it might attract an allegation of destruction of evidence. Okay, so you should be careful. So understand these orders better and implement them. That will save you a lot of headache. That is the first thing. Then coming to the core topic for today. What is the difference between ethics and law? Where ethics stops and where law starts? It's a very thin line between ethics and law, right? In fact, this is not only two parts or two faces of the coin. There is more to it. Many people are of the impression that it is either ethics or law, but there is more to it. I'll give you an example. Many years ago, one of the whatever examples I'm stating are either have been encountered by me or has been shared with me by one of my friends. So a young couple who were residing abroad came to India for antenatal checkup. It was about 25 weeks of pregnancy, and on the ultrasound scan, the doctor detected that one of the limb is having an anomaly. Okay, so limb anomaly itself is not a life-threatening situation. Okay, now the couple did not want to have a child with a limb anomaly, so they decided to opt for termination of pregnancy at 25 weeks. Now the question is to the administrator. Okay, the patient wants termination of pregnancy, the mother. The father doesn't want termination of pregnancy. Okay. The doctor is not in favor of termination of pregnancy for two reasons. One is because it's only a limb anomaly. The second is it's already 25 weeks of pregnancy. The institution in which the patient presented is pro-life. So they are not keen on medical termination of pregnancy. Now, what would the administrator do? Anybody? If you need any more information, I can share. As an administrator, what would you do? The patient herself is insisting that she has to undergo medical termination of pregnancy. The husband is not aligned. The doctor is not aligned. The institution is not aligned. In this situation, what do you do? Also, you have taken consultation charges and also you have collected charges for the ultrasound. So there is a duty. Anybody?
Counseling.
Yeah, if you can just tell your name and share your response, it will be nice.
Hello.
Yeah, please go ahead.
I'm Dr. Vasili Panakaraja from Apollo University, Chittoor.
Pharmacologist.
No, sir. Apollo University.
Yeah. What are you, doctor? Doctor in what?
Dental, sir.
Dental doctor. Tell me, doctor.
Sir, I feel like counseling the mother is the better way to approach in this aspect, sir.
What will you counsel her?
Counseling the patient about why the necessity of life and how many what are the other chances if at all you go for termination of this baby, you are losing a child, so which is more precious, life is more precious, no sir. So counseling her in that aspect.
So the patient has a right to decide what happens to her body.
Yes, sir.
It is my child. I will decide what will happen to my child. I cannot see a child which is suffering for the rest of its life with one limb or a limb which is not, normal. That is the mother's dilemma. Whether you go by her or what do you do then?
Actually, according to legal aspect, it is up to 3 months. Before 3 months, it is legally permitted, sir.
So that's the thing. This happened many years ago. At that point in time, the medical termination was allowed up to 24 weeks.
Okay, sir.
This lady presented at 25 weeks.
Okay, sir. It is one way is that we have to counsel the patient, sir, according to me. If at all she is not accepting that, we have to make even the husband to, actually her husband is also accepting. So we have to make sure that her husband also speak to her about this issue.
All that
That's
is over.
anyway.
This is very clear. Counseling part is over. Now, as an administrator, what do? You refer this patient or you tell the doctor to terminate the pregnancy.
For the patient is better option, sir, rather than saying the doctor to terminate.
So you will you refuse the termination, right?
Sir?
You will refuse the termination. You say, I cannot do.
No, I don't refuse, sir, but I would say that better go for. So refusing the patient is like denying the patient having the basic treatment.
Yes. Yeah. So what do we do? Anyway, in the interest of time, anybody else has got any answer? So basically, we are confused what to do with this patient. Now, one way to approach this is talk the patient's language, right? The problem here is everybody, the patient, the husband, the doctor, and the administrator are talking in different languages. They are talking in their own language. The patient is talking in the moral language. It's a moral perspective. What's right for me, what's right for my baby is my personal choice. So it's a moral question. She is entitled to take that call. What's good for her body, what's good for her child. There's nothing wrong in that. So you need to tell her that we respect your opinion. You are completely within your rights to seek medical termination of pregnancy. That is first. Second thing is, you need to talk the scientific language and make her understand the language of the doctor. The doctor's perspective also has to be communicated to her. Okay, now you are within your rights to seek termination, but the doctor feels that medical termination is not necessitated because it's just a limb anomaly. There is absolutely nothing which prevents her, the baby, from living independently. She should not be a burden to the society or you. Also, there is an element of risk because of advanced pregnancy, right? That is the doctor's language, or the scientific perspective has to be explained to her. The third thing you need to explain is the ethical perspective. Ethics is what is determined by a group of professionals or a body of individuals, some cohort within the society. In this case, it's an institution. In some other case, it could be a group of individuals, a religious sect. So you need to tell ethically it is not acceptable to terminate life at this advanced stage, especially when it poses no risk to the parents and it can live independently. So that is the third perspective, the ethical perspective. And the final thing, if she's not yielding to all of this, you need to bring in the legal perspective and say, okay, now that I agree, you are within the rights to demand termination. The doctor, though the doctor feels that it is not indicated, even if the doctor is willing to do, even if the hospital is willing to do, but the law does not permit. The law of the land does not permit me to do termination beyond 24 weeks. You need to communicate this way. You need to go up the ladder and break news in installments. You cannot directly go and tell, no, it is illegal, I will not terminate. You will get into issues. Then you will find yourself with a lawsuit, right? So this is the thought process I wanted to introduce in young administrators. Speak the language, understand the language of the patient. You understand whether the patient is talking in the moral perspective, or the scientific perspective, or the ethical perspective, or the legal perspective. Ultimately, the legal perspective has to prevail. Now, not all situations there is a law. Before 1994, there was no law governing organ transplant, right? That in those days, you could decide whether you could donate your kidney to your neighbor. Absolutely okay. When people started using this, when there was exploitation, when there was commercialization, the Organ Transplant Act came into vogue. So the law always catches up with science. There are many situations where there is no law, right? So you have to understand the four perspectives and whether there is a legal perspective. If there is a legal perspective, it will prevail. If not, the ethical perspective will prevail. Even if there is no ethical perspective, then you will have to come down to the moral perspective. Is it clear, the hierarchy? Okay, I have explained this. All this, whatever I said, is based on four principles in medical ethics. The first one is, whatever decision you take, you need to honor these four principles. Autonomy, that is, respect the patient's right to make informed choices. Beneficence, do what is good to the patient, act in the patient's interest, best interest. Non-maleficence, if you can't do good, then don't do harm. Okay, I'll come to that. And then finally, justice or equitable justice. So all of these principles have been highlighted by the courts and upheld by the courts. Okay, quickly. First, the autonomy. So there is a young lady who was divorced, had to undergo a procedure for the uterus, multiple fibroids probably, I don't remember that, but was admitted. The doctor came and she was supposed to undergo removal of the fibroid. But during the course of the operation, the doctor realized that it is more than a fibroid, it is some malignant condition. So in the interest of the patient, decided to remove the uterus. So hysterectomy was done. Then the next day, after she was shifted from the post-op ward to the room, the doctor came for rounds and told, don't worry, everything went well, you will never bleed in your life. So the patient was puzzled. She asked, what do you mean by not bleeding again? So he told, I have removed your uterus. The question the patient asked was, who permitted you to remove my uterus? So the doctor said, because you are divorced and your bystander said that you don't have any other plans to marry. And she, in your interest, gave the consent. What do you think? Is that the right way? Is this the right way? Can you do it to her as an administrator? So in this case, the doctor assumed that the bystander is acting in the interest of the patient. But in reality, the story was different. This woman was independent, she was single, but she had future plans of marriage and future plans of family expansion. So to that extent, her dreams were demolished. So she filed a case against this doctor and she won the case. The Supreme Court held that you have to respect patient's autonomy. Okay. It's also said, it is also laid down in law. In medical termination of pregnancy cases, the consent of the female is enough. Husband consent is not needed. It's very clear now. Okay, no confusion there. Respect patient autonomy unless the patient condition precludes him or her to take an informed decision, right? As long as the patient is conscious or there is no emergency situation, you need to check with the patient and do what the patient says. No deviations there. Second thing is beneficence. So whatever we do should be done in the best interest of the patient. The paramount duty of the doctor is to save life. Rest all comes later. So this, again, this landmark case, Paramananda Katara versus Union of India, an young guy was refused treatment after he met with an accident. He was refused treatment in multiple hospitals because he had no bystanders. Patient immediately was taken to the nearby hospital but refused treatment, referred to a government hospital, and because of that he suffered. Probably passed away also. So in that case, the court held that not providing immediate emergency care is failure of duty. So we are bound to provide immediate care. Immediate care is care that is enough to sustain life. You need not do the elective procedure. You just have to make sure that there is no further damage. It's easier to say but difficult to do in practice, but you have to manage the optics. You have to make sure that the patient's condition will not deteriorate enough to result in loss of organ, loss of limb, or loss of life. To that extent, you need to stabilize him and refer. This is also laid down in Paramananda Katara versus Union of India. I think at least you should read these top four judgments. You'll get an idea as to what is the thought process of the lawmakers and the honorable judiciary. As I said, ignorance of law is not an excuse. If you go through these key cases, you will get an understanding of law and what not to do, at least. And third thing is non-maleficence, where you, at least if you're not in a condition or a situation to do good, don't do harm. Okay, IMA versus VP Shanta case. This is a landmark case. Every administrator should read this. This is the case which changed the dynamics of healthcare head-on. Until this judgment, patients could not approach a court against a doctor in India, right? In India, patients could not approach a court against a doctor or a hospital. But this judgment brought healthcare under the ambit of Consumer Act, Consumer Protection Act. Since then, you will find this medical negligence cases, suit for civil compensation going up. This is a landmark case. It belongs to Kerala. On the other side, the court also is careful or conscious of the need to protect medical people. So the liability, the police cannot come and directly arrest a doctor just because a complaint of negligence is made. They have to refer it to a medical board. The medical board opinion has to be taken. Then only they can proceed with penal steps. So there are two judgments. Both of these you should be aware. I can take questions if you want to know more about this later. The last one is equitable justice. Let us say, in this case, it is very clear, if you don't have a particular specialty or a service or a doctor, then don't try to provide that treatment. Let us say you don't have a pediatric cardiologist. Okay, so don't try to do a heart intervention for a child. Better to refer him or her. Okay, that is what it means. The last one is equitable care. Let us say there is a situation where two patients come and both require ventilator, and you have only one ventilator. What do you do? What do you do? Two patients come, there's a mass casualty, two patients are coming, both need ventilator, and you have only one ventilator. What will you do? Whom will you offer the ventilator? Anybody?
Sir, we will see the age of the patient. Who will more younger, we will give priority for this patient, sir.
So the 45-year-old male is there and the 8-year-old boy is there. Whom will you save? 45-year-old is the breadwinner for the family. Will you neglect the 45-year-old because his age is older in age?
Based on the critical condition of the patient.
Both are critical. That's why both need ventilator.
evening, sir. I'm Shivin Singh. I'm from ʀᴇ괱ᴜᴜ University. As my friend Vasanthi said, we should be focusing on the severity. Like, I think we should save the 45-year-old because he's the breadwinner and the entire family depends on him.
So, yeah, so just you'll have to go through this judgment, you'll get clarity. It is equitable care. It's not equal care. It is equitable care. One who is likely to benefit more out of your intervention should be offered the intervention. Okay, saving a 45-year-old breadwinner will definitely save or will be more beneficial than saving a young boy who is very early in his life. Okay, it's not that we have anything against the boy, but the situation is such that we cannot have a political solution. We need to have a practical solution. In those cases, you need to abide by the ethics. Okay, the law will not say that you should give care to first come, first serve. You will have to go by your judgment, and your judgment should be guided by these principles. If you can substantiate that your judgment was based on such principles, then it will be appreciated. Basically, the right to life and personal liberty are two important topics, two important values which are protected by our constitution. And you should be aware that this is flowing down from the constitution to the various Supreme Court judgments, the various acts, the various government orders. All this form part of the law. Judgments by the Supreme Court also are part of the law. Okay, it's called common law. So when in doubt, you should seek a proper legal advice. But having an idea about law is always encouraged because, as I said earlier, ignorance of law is no excuse. So these are the key judgments you can go through, and you will realize how healthcare has changed. Every time a development happens in healthcare, the law catches up subsequently. Now we have a law to regulate artificial reproduction. We have a law to regulate a lot of sophisticated procedures. We have a law to regulate surrogacy. So all these things are there. So as medicine or science evolves, situations will arise, and then only law will be enacted. Until then, you need to go by this route. The order is reversed. I'm sorry for that.
7:44 p.m.
Yeah. So first you'll have to understand the moral language, and then the ethical language, also the scientific language, the ethical language, and then the legal language, which will ultimately prevail. So again, ignorance of law is no excuse. Both medicine and law are very key pillars of our society. Good medicine is always guided by good ethics, and good law is always guided by compassion. Any compromise in both is detrimental to the society. Okay, so it's time for some question and answers.
Thank you, sir, for your enlightening session. Your insightful thoughts on balancing ethical principles with legal obligations have provided us with a deeper understanding of responsible healthcare practice. We sincerely appreciate the time, experience, and wisdom you have shared with us today.
We shall now move on to the interactive Q&A. Participants who have already posted the questions in chat box will have their questions taken up first. If you would still like to ask a question, kindly mention your name and institution while posting it in the chat. We will try our best to accommodate as many questions as time permits.
Will you be reading out the questions, or should I?
Sir, questions are being posted in the messages.
No, I'm not able to read the complete question. It's
Okay, we'll read out then. We'll read out.
You can choose any question.
Okay, we'll read out.
So we have a question from Ansi Joby.
Ansi
Is it possible? to remove
It's possible
ventilator
to
from a
remove
patient
ventilator from a patient as per
as per
law
law.
of order. Yeah. So that's what the judgment, Common Cause Society versus Union of India, the law is laid down. Okay. Now, it is possible, provided you approach the district medical board. The district collector is supposed to constitute a medical board, and that medical board has to certify that further treatment is going to be futile. Futile in the sense, it is not going to improve the quality of life, or it is going to severely impair the dignity. The dying with dignity is what the second part is. There are two parts to this. One is living with dignity and dying with dignity. Okay, so living with dignity is anyway not possible because is terminally ill and heavily dependent on the ventilator and artificial life supports. But dying with dignity is also important. That is what this court judgment recognizes. It has laid down some safeguards because it should not get exploited. So there are some safeguards which are not very well circulated or published. So in practice, it's not implemented, but yes, court has recognized that it is possible. One step behind, if you go, passive euthanasia was also recognized by the Aruna Shanbhag case. Aruna Shanbhag case, you must be aware, when a young nurse was strangulated by one of the colleagues and she developed went into persistent vegetative state. So both have given legal recognition, but the rules to implement this are yet to be well published and implemented. Maybe in 2 to 3 years' time, you will have better practices coming out. Until then, I think hospitals are practicing with medical boards. Medical board is formed and a collective decision is taken not to escalate care, and then they are de-escalating care. Yes, that is being practiced.
So we have a next question from Kavya Vinod, Quality Executive of Dr. Sunny Home Healthcare. The question is, if a patient's family asks the doctor not to tell the patient that they have terminal cancer, what should the doctor do?
So there is this
patient autonomy or family wishes come first?
Of course, if the patient is an adult who is having the senses to take an informed decision, it should be informed, but not right away. There is this law about AIDS. If the patient is a female, you cannot disclose it to her husband. Okay, even if the husband demands. But if the patient is an husband, you will have to disclose it to the wife, but not immediately, over a period of time. So you will have to use your discretion and substantiate that this was based on medical ethics. Okay. Not disclosing is not an option. You will have to do it at some stage. But how do you do? As I said, take that ladder and you'll have to break it in installments. If the patient ends up knowing that you have connived with the family and not disclosing, he can take you to the legal forums. Not disclosing is not an option, but when to do, how to do is the question that you need to ponder about. That a senior doctor would be the best person to guide you, and the doctor will have the rapport. So leave it to the doctors, they will break it slowly, but eventually.
Sir, the next question is from Dr. Akshita Bansal from Lucknow.
One second.
Do we have to go for...
1 second. I'll just go back. There is another case, X versus Z, I think. It's related to HIV. One patient had HIV and he gave blood, and that hospital failed to inform him. He donated blood and hospital failed to inform him about his status. There is a case related to that. Is another case you should go through. When he donated blood, when he donated blood, the screening test revealed he had AIDS, so that was revealed to somebody else. and the marriage got cancelled. So there was an issue there. So this such issues should be told to the patient first, preferably. Otherwise, you can land up in trouble if you tell to somebody else other than the patient. It depends on the condition. If it is a terminal cancer, probably if you feel that the patient might react very irrationally, you can hold back for some more time. But sensitive issues which will affect life and this stigmas, concerning the stigmas, you should be more careful is what I advise. Again, there is no hard and fast rule here. You need to go case to case. That's where you need to, more you deal with these situations, the better you will be able to handle them in future. Please go ahead.
Sir, the next question is from Akshita Mansal from Lucknow. Do we have to go for MLC procedure in case of destitute patients and brought dead patients with no contacts of kin?
So any death which is sudden, unexplained and unknown, the reason of death is unknown, you need to call the cops. There is no doubt. Because then the body will belong to the state. State means the government. Okay, if there are no bystanders, if it's a destitute, the body belongs to the state has to be informed. And police are one of the pillars of the state. So they should be informed. If you don't inform and bury the body, and it might lead to destruction of evidence if that person happens to be someone very important also.
Sir, next question from Dr. Jishnu from the Apollo University. In the example provided above, the mass casualty of two people, 8-year young boy and a 45-year-old breadwinner, does the family of 8-year young boy have the right to file the case on hospital for not choosing the son for the ventilator?
Yeah, they will file. They can file and they might file also, but you have to substantiate your decision by giving these principles. I acted in best interest based on equitable justice. So for that, you should read some judgments, and there are precedents where equitable justice is, upheld. You see, it's an emergency. There is always a margin for margin of consideration which the courts will give towards the medical man. Okay, it's not that they have denied the ventilator for the sake of denying, but they have used the ventilator to do something good. So it can happen. You cannot rule out that possibility. So that's why in administration, you need to be careful. Communicate well. Communicate well. That is the key.
Sir, the next question is from Praveen Kumar. What happened to the pregnant lady if she don't want baby because of anomaly? Will just refuse to MTP or file a case?
So in this case, as I said, you need to give her talker language and make her understand. Even after that, if she is reacting irrationally and demands MTP, you are within your rights to refuse MTP. She can approach the court, and court will, based on these precedences, recognize that, life-threatening situation is not there. So there is no need for MTP. By the way, in that case, I'll tell you, again, this is the best part of healthcare. The anomaly scan was repeated after 1 more week because all these discussions dragged on. And after 1 week, again, the scan was repeated. In that, 4 more fingers were visible. Actually, the child had only 2 fingers missing. So again, medicine is an art, a science, and a commerce. But above all, there is something which we cannot explain, and the kid was delivered and the mother was happy. Only 2 fingers were missing because there is a limitation to this ultrasound, right? Okay, you can call it an happy ending, but sometimes you need to be lucky when you're in administration. Such good things will happen if your intention is good.
Next question from Mustahir
But
F.
you never know
Sir,
what the
how
court
do
will decide. You never know what the court will decide. That is for the courts to decide. You can only substantiate what you have done. Okay.
Sir, the question is, sir, how do cultural and religious beliefs influence in ethical decision making in hospital?
So depends on, again, as I said, the culture and belief will operate at two levels. One is at the moral level, one is at the ethical level. The other two perspective I told you, it is the scientific perspective. So it is very rational way of looking at things, the scientific perspective. The moral perspective also is going to depend on your cultural beliefs, your religious beliefs. All this will contribute to your thought process. So at the individual level, also it will operate, and at the group level also. So if you are part of a certain community, there is a group of people, there is a religious denomination called Jehovah's Witness. Okay, so they don't accept blood transfusion. That is not good in their belief. So there are such instances where religious beliefs will contribute to certain perspectives. We need to respect that to an extent, and that's it. So if a Jehovah's Witness comes and refuses blood transfusion, what can you do? Unless it's an emergency, you can't. It's their autonomy. They have chosen that, and you need to respect that.
So the next question is from Shashikala V. Sir, if a patient takes time to decide, disease get worse, is it considered as medical negligence, or is it the fault of the patient?
Okay, very good question. See, there are four elements to constitute medical negligence. There are 4 Ds. First, there should be a duty. There should be a damage, a dereliction of duty or failure to do a duty properly. Then there should be a damage, and then there should be a link between the damage and the duty. Okay, the first D is there should be a duty. If you have agreed to treat a patient and you don't turn up, then there is failure of duty that will attract medical negligence. Now you have managed to come and see the patient, but you did not apply reasonable skill in treating that patient. Reasonable is again subjective. What 8 out of 10 people do, you are expected to do. You are not expected to do some fantastic diagnosis. But if you fail to miss an appendicitis, then it is going to appear very, very poor. If you are going to operate on a wrong limb, wrong side of a limb, that is, those type of things will obviously be determined as negligent. But if you are exercising reasonable skill and care, despite that complications happen, then that will not be viewed as negligence. Deterioration in in a condition or failure to diagnosis per se will not constitute negligence. What constitutes negligence is there should be a duty, there should be a failure to do the duty in a reasonable manner, and there should be a damage. Let us say a patient who was admitted after surgery developed severe tachycardia or fast heart beating. They called you, patient panicked, heartbeat increased. They called you, the surgeon, but you didn't turn up. But eventually nothing happened to the patient recovered. So there is no damage. They can just tell that no, you didn't come, so there is failure to do your duty. But what is the damage? There's no damage, right? In that cases, the allegation of negligence will not stand. But the tachycardia goes out of hand and he has a cardiac arrest, then you had it. So medical diagnosis, medical negligence is not very easy to prove. You have to prove all the 4 elements of medical negligence. Then only it will stand before the court.
Next from Hilal Sunis. With increasing use of AI diagnostic tools, who should bear the legal and ethical responsibility if an AI-assisted clinical decision causes patient harm? The doctor, hospital, or the software developer?
Very good question. Again, this is evolving. This space is evolving. We are also waiting for judgments to address this. Until then, it can go either ways. It can go, the AI can be held responsible or the doctor can be held responsible. So, interesting question, but I am also eagerly watching this. So the thing is, again, you'll have to establish the duty. If the patient has opted for AI by himself, then I don't think the doctor can be blamed. But if the doctor has recommended him an AI solution, then there will be a partial liability, is what I understand. So there are cases where patients have gone with AI and either overdosed or underdosed and resulted in complications. But they have not yet reached the case, reached the court or a decision status in the court. There could be there somewhere in some of the courts, but the decisions have not come out. So honestly, there is no law as of now. Okay, it's just and AI also is changing so rapidly. Maybe court also will take time for understanding the same. And you don't depend on AI for answers to such questions. It might land you in trouble. Please take professional help.
Sir, can you take one more question?
Very nice questions. I'll be happy to take.
Okay, sir. From Tranvi Puta, quality person. I have a question. Medico-legal cases where if the doctor suspects that it's an to file the case and take the patient away.
I didn't get the question. Can you please repeat it?
If it's a medico-legal case where if the doctor suspects that it's an MLC, but attenders deny to file the case and take the patient.
Oh, okay. So you have to first intimate the cops and note down that document that you have informed the cops. Okay, that is enough. If the public gets instigated or they get carried away by emotions and take away the body, you are a doctor or an administrator. You can do what you can do. You need not go and fight with them physically and risk your life and the hospital property. Never do that. You inform the police on time and you document that you have informed. Okay. Safer is to send an email also, if possible. You don't go and stop the public from what they're doing. It's not worth the risk. I've been in such situations, and out of experience, I'm telling the police have to intervene in this. It's a matter for the police to handle, not you as a healthcare provider. You're only responsible for intimating. Okay. Despite your best efforts, if the body is taken away forcefully, you have to write that the public sentiment or the public outcry was beyond my capabilities to take safe custody. So the documentation is important. Okay, first ensure your safety so that other patients can be saved. Okay, that is how the court will look at it. There is a MLC mishap. Does management try to cover the financial damages via which funds in the budget, and like does management? So it goes like this. In criminal cases, the individual is responsible. If the medicine was prescribed by a doctor and the wrong medicine was administered by somebody else, that person is responsible. That will invite penal offense. That is they will be put behind bars or whatever. In civil matters, the liability will come on the person with the deeper pockets. In this case, it will be on the hospital. The hospital has to first pay the compensation, if at all awarded, and then it can recover from the doctors depending on its contract with the doctors. So the courts will always award a compensation in the name of the person with deeper pockets. That means, by and large, mostly it will be the institutions, not the individual doctors. The institutions can recover from the doctors subsequently. So individuals always, advise doctors to have their own indemnity scheme so that they will not have to pay from their personal funds. Okay.
Thank you, sir. Thank you, everyone, for your active participation. As we are running short on time, any unanswered questions can be emailed to us, and we'll get back to you as soon as possible. Once again, we sincerely thank our speaker for patiently addressing the queries and sharing valuable practical insights. Stay connected and join us for the next webinar with Dr. Abel George, CEO of Apollo Atlas Hospital, as the speaker. Hope you will join us for the webinar.
As we conclude today's webinar, we kindly request all participants to complete the online feedback form. Your valuable feedback helps us improve our future programs and the upcoming Astricus 27 International Conference and Workshop. The feedback link will be shared in the WhatsApp group. Kindly note that the link will remain active for 4 days, and e-certificates will be issued only to participants who submit the feedback form.
On behalf of the Department of Hospital Administration, we sincerely thank our esteemed speaker, Dr. Nalanda Jayadev, for his valuable session, and a heartfelt gratitude to our respected Dean, HOD, and all our teaching and non-teaching members for their constant support and guidance. A special thanks to all the participants for joining us today, and my colleagues for their efforts in making the program a great success.
With that, we come to the end of today's webinar. We look forward to welcoming you again to the next session of Astricus 27 pre-conference webinar series.
Until then, stay safe, keep learning, and have a wonderful day. Thank you.